An otoplasty is the procedure that changes the shape of the ears. Many times, prominent ears are caused by either a large component of the ear or an absent fold in another part of the ear. So otoplasty really changes the shape by either recreating the folds in the ear or by contouring a more prominent part of the ear and setting it back closer to the head. The youngest age someone can have an otoplasty is usually 6 to 7 years old. We know that at the age of 6 or 7, the ear is about 90% of its adult size. At that time, any surgical intervention will not affect the overall size of the ear. Many of my otoplasties are performed before kids go into kindergarten or first grade at the age of 6 or 7 years old. And that's because many parents don't want the ears to become a social issue for the child. Otoplasty is very commonly done in adults, and typically we have patients who've had a lifelong concern with the shape of the ears who have not been able to do anything about it. Many women who've had prominent ears their whole life try to conceal their ears underneath their hairstyle, so they never wear their hair up. After otoplasty, the first thing these patients do is put their hair in a ponytail, and it's very interesting to watch that transformation and watch how women react to the otoplasty procedure, but we commonly perform this procedure in adult patients as well. Postcare with otoplasty is fairly straightforward. We make incisions in the crease behind the ear so there's no visible incisions. The incisions are cleaned 6 times a day with hydrogen peroxide and a Q-tip. We remove those sutures typically at 2 weeks after surgery. We ask patients to wear either a headband or a skull cap for 3 weeks after the surgery, 24 hours a day. And then after that first 3 weeks, we ask them to wear the headband or the skull cap while they sleep at night. And that's to ensure that the cartilage retains its memory in its new position and doesn't change shape. Typically, when the otoplasty procedure is performed in children, it's performed under general anesthetic. In adults, the procedure can be performed under local anesthesia. We simply just need the patient to relax during the procedure. There's a small amount of pain in the front part of the procedure. The discomfort while we put the local anesthetic in lasts approximately 2 to 3 minutes, but after that there's no more discomfort. And all of my patients tolerate the procedure very well under local anesthetic. The recovery process for otoplasty is very short. It's about a week. We typically remove sutures at 2 weeks, but because those sutures are concealed behind the ear, nobody knows that they're there. All of my otoplasty patients return to full unrestricted activity 2 weeks after the procedure.